Good evening, our viewers. You are watching Tigrai television live from Magala. Here are today's news. 2 children have died in a drone attack conducted in the town of Shire on Friday. The attack also wounded many civilians, including a pregnant woman. Our reporters on the ground spoke with the victims of the drone attack, who say the attacks were conducted on civilians' residential area. Let's take a look.
The attack was on a pregnant woman and a child. These are innocent civilians. This one is pregnant. The other is a 3-year-old child. They were hit near their houses. It is in Kabale Zirarata. There is a market around the area. There is nothing related with military operations or military logistics. It is just civilians' residential area. These show you that they are targeting civilians in order to eliminate all of us, the Tigrayans.
I was carrying my child when it hit us. I was just passing by. I don't know where it came from. I had fallen with my baby. I injured my waist and both of my legs. They're just targeting civilians. I was just a passenger.
International Rescue Committee says it has confirmed the death of its employee in a shelling in a Shire conducted by Eritrean forces on Friday. The committee also says another employee who is a member of the health nutrition team was also wounded while delivering humanitarian aid to women and children. IRC says it is very heartbroken by the incident that has claimed the lives of its employee and 2 other civilians, as well as the injury of many more. Chief of United Nations Office for Coordination of Humanitarian Affairs, OCHA, says he's beyond worried about the safety of civilians and humanitarian staff in Shire. UN Humanitarian Chief Martin Griffiths on Friday wrote on Twitter that he is horrified to hear 2 front-line staff were injured in shelling by Eritrean forces. Eritrean forces continue to conduct heavy artillery shelling in the town of Shire almost on a daily basis since they launched new round of full-scale offensive a week ago. Expert in international relations, Dr. Molarada, says the withdrawal of Eritrean forces would go a long way towards ending the ongoing war. In his brief stay with Tigrai television, Dr. Molarada noted that the Eritrean government is the main architect of the war on Tigray that has been waged for close to 2 years now. Abel Zagabu has more.
It is to be recalled that the United States and other 5 countries released a joint statement on Wednesday, 12th of October 2022, to express their concern on the resumption of hostilities in Ethiopia. The joint statement called upon the Eritrean forces to stop their military operations and to immediately withdraw from Ethiopia. We have asked an expert of international relations and comparative politics, Dr. Molarada, for his insight on Eritrea's involvement in the war in Tigray. The expert says withdrawal of the Eritrean forces is essential to find a peaceful way out to the current crisis.
I don't think it can solve all of the crisis that we're facing in the moment, but it would definitely go a long way towards finding a peaceful way out of the current crisis. Because the Eritrean army is knee-deep in Tigray at the moment. It is brutalizing our people. In fact, the Eritrean army is deliberately targeting, for example, the Kunama community in Tigray. And so by eliminating these ethnic minorities, it assumes that it can bring about a different kind of political dispensation. And so the withdrawal of Eritrean forces, I think, will go a long way towards ending the current conflict, because at the moment, it's not just the Ethiopian government that's fighting Tigrayan forces. In fact, for all intents and purposes, the Eritrean regime is leading. It is the principal architect of the war at the moment. And so the withdrawal of Eritrean forces is not enough, but it is a necessary condition for the peaceful resolution of the current conflict.
He also blamed the Eritrean government for using starvation as a weapon of war, reminding UN OCHA's accusation of Eritrea's government for impeding about 130 of humanitarian operations in May of 2021 in Tigray.
Oftentimes when we talk about the use of starvation as a weapon of war in Tigray, people usually start since the end of June 2021, when the government Tigray assumed its rightful position here in Maqala. But it actually predates that. By the end of May 2021, the United Nations had documented about 130 incidents of humanitarian aid blockage, in which aid workers were harassed, intimidated, beaten, murdered, and turned back at checkpoints manned by the Eritrean and by the Ethiopian government militaries, as well as by Amhara forces. 50 of these 130 incidents were accounted for by the murderous Eritrean army. 50 other incidents were accounted for by the genocidal Ethiopian army. And 27 of these incidents were accounted for by an assortment of ragtag Amhara forces that were roaming freely across Tigray. All right? And so 130 incidents of humanitarian aid blockade. In fact, the Eritrean government's violation of international humanitarian law was so egregious that the then head of the United Nations Office for the Coordination of Humanitarian Affairs, Mark Lowcock, publicly singled out Eritrea for using starvation as a weapon of war against the people of Tigray. Unfortunately, the international community did not heed his calls and mete out appropriate punishment against the Eritrean government.
Speaking about the way out of the crisis, Dr. Mullah says the international community should call what happens in Tigray by its proper name, genocide.
The international community has access to a robust package of policy tools that could incentivize the Abiy government and the Eritrean governments to withdraw from Tigrayan territories and to press the Abiy regime to allow unimpeded humanitarian access to Tigray. But the international community, if it cannot call out, for example, what's happening in Tigray by its proper name, that is aggression, invasion, genocidal assault, then it can't prescribe appropriate policy solutions to bring the problem to an end. So,
despite multiple statements of concern by the international community, Ethiopian and Eritrean forces continue their military operations in Tigray, including the indiscriminate aerial attacks that have left countless civilians dead and public and private properties destroyed.
A catastrophic humanitarian situation is currently unveiling in many parts of Tigray as widely displaced persons continue to flood into shelters. The resumption of hostilities that brought with it continuous and indiscriminate shelling has displaced many civilians from their homes, most with nothing on them upon arrival at IDP camps. The siege on the region that has blocked all humanitarian aid has also made life at these camps unbearable for many. Sarah Khalali has more.
It is no surprise that a more than a year-long siege on Tigray and the resumption of hostilities will bring with it a devastating humanitarian catastrophe. Many civilians continue to be displaced from their homes due to conflict, and the number of displaced persons arriving at IDP camps every day is staggering. As Dr. Hayilam Kasai of Tigray Health Research Institute puts it, the number of newly displaced persons continues to rise, and thousands more are expected to arrive as the war on Tigray continues.
We have many new IDP sites, and the number of the number of the war fronts are increasing, especially in the south northwest area and in the eastern part. Especially in the first weeks, we had around 89,000 of internally displaced people. Then before 2 weeks, we have around 346,000 internally displaced people, and by now, before 3 or 4 days, we have around 432,000 of internally displaced people. So by now, we expect just around 500,000 internally displaced people by this time.
While the number of newly displaced persons is overwhelming, as reports indicate, shelter, food, and medical supply for these IDPs is almost non-existent. Many pregnant and lactating mothers, as well as patients with chronic illnesses, continue to arrive at these camps, but proper care is unavailable.
The worrying thing is not only the number. The main worrying is, one, usually these IDPs, they come without anything, without something to eat, without anything to drink, without any shelter. And life there in the IDP sites is very worrying. They don't have anything to eat at all. So almost anything. they are living in the forests, in the streets. They spend day and night without any shelter. The other news that we are hearing is we had also some IDPs from the Eritrea. So you see, the life in the current IDP site is very harsh, very hostile, but people from Eritrea are still joining these IDP sites. So you can estimate what the life condition in Eritrea right now. It is much more worse in our IDP sites, that means. So this is the indication.
On top of the humanitarian crisis, Dr. Hayilam also stated the amount of medical supply that entered into Tigray so far is nowhere near the yearly demand.
The amount of medical supplies that come to Tigray from these different non-governmental organizations in the time of even humanitarian truce, it was around 5.5% overall of the demand, of the year demand. That means 95% of the people will be without medication. Sometimes we hear some news that there are many medical supplies coming to Tigray, but there is inappropriate usage of these medicines. No, we do. From the outside, we are not receiving enough medicine. Not only enough, very limited medicine. Just even the program medicine in essence, something that we receive by partners. Just you get them from some donors. Even those is what we get in the last 9 months is 6.7 of the year demand. So that means the Ethiopian government is cutting these medicines to enter to Tigray.
As medical supply continues to be blocked from entering the region, the doctor called on the international community and concerned bodies to stop the crimes against humanity being committed on the people of Tigray.
During crisis, receiving medical care, not only the civilians, even the POS, prisoners of the wars, the wounded patients, wherever from they are, they have the right to get medical access. Yes, it is. During crisis, getting medical care is just human right. So this is clearly stated under the international humanitarian law. As I have told you, we are not getting enough medicines. Our pregnant mothers are not getting ambulance services. So many outbreaks are just without control. Very treatable patients are dying due to lack of oxygen. This is automatically crime against medical neutrality. Right? So anybody, whoever he is, I am saying, have the right to get to be treated, to get medical service. And if somebody is blocking to get medical service, he is committing crime against medical neutrality. And in fact, this is automatically crime against humanity. So for all the international organizations, what I would like to say is, let's follow the basic principles of humanitarian aid. Let's have clear plans. And we need to work the people in need. We need to help the people in need. Otherwise, the health catastrophe of Tigray will be very, very difficult.
Renewed attacks by the allied Ethiopian and Eritrean forces continues to displace many Tigrayans from their homes, some for the second time around. But what awaits displaced persons at these camps is worse than what they have fled to escape.
The United States called on the Ethiopian National Defense Forces and the Eritrean Defense Forces to immediately stop their joint military operations in Tigray. In a press statement on Friday, the Secretary of State, Anthony Blinken, said the United States is deeply concerned over the reports of increasing violence, loss of life, indiscriminate attack on civilians in Tigray, particularly around Shire and northwestern Tigray. The statement also called on the warring parties to allow unfettered humanitarian access to Ethiopians in need. Professor Tony Magana, who served as the head of neurosurgery department at Eider Comprehensive Specialized Hospital, wrote an open letter to Howard University opposing the use of universities venue for the promotion of healthcare achievements of the Ethiopian government, while it's practically blocking the people of Tigray from accessing medicines and medical supplies. Professor Tony highlighted in his letter that more than 6 million people in Tigray have been suffering from the lack of essentials such as medical supplies, and that even federal hospitals in Tigray are not functioning as a direct result of the Ethiopian government's effective blockade on Tigray. In his letter, Professor Tony stressed that by providing venue to the Ethiopian government that has been inflicting unspeakable harm to its own people, the Howard University is degrading its fine institutional legacy. The Ethiopian government and Eritrean governments have been waging a genocidal war against the people of Tigray for over 2 years now. Accordingly, they are also exterminating ethnic minorities of the Kunama people who live across the borders of Tigray and Eritrea. Our reporters had a brief stay with members of the community to shed light on the crimes against our people. Aragawi Gabramkel has the details.
The war on Tigray has seen horrendous atrocities amounting to war crimes and genocide. The people of Kunama, an ethnic minority in the region, have suffered unspeakable horrors under the occupation of allied Ethiopian and Eritrean forces. We spoke to members of the community who say Eritrean troops have continued carrying out their genocidal rampages on the people of Kunama.
They looted farm of the community, and they burnt what they couldn't take. This is what they did last year, and they are repeating it. It is easy to imagine what they would do if they can control other parts of Tigray. They burned villages and looted properties. They also destroyed public infrastructures such as schools and health centers. Now the people have no means of keeping themselves healthy.
Members of the Kunama community say the Eritrean government is also targeting ethnic communities in Eritrea and Tigray.
We have relatives in Eritrea. The Eritrean government is exterminating the people of Kunama in Eritrea. This is a continuation of what they were doing in Eritrea. The atrocities that were committed in Ashemblina, Ademit, and other places are systematic, and they want to exterminate the society by killing children and pregnant mothers.
The members of the Kunama society also forward their message to the international community to play its role in ending the genocidal war waged against the people of Tigray.
The Kunama people are a minority and become victims of the ongoing genocide. As a result, the community is under a threat of extermination. So the international community should go beyond rhetoric, condemnation, and act to stop the genocide that is being committed against all Tigrayans.
Semen Health Center, based in Mekelle, the capital of Tigray, reported that children under 5 are suffering from hygiene-related illnesses as child care service in the region deteriorates amid the all-encompassing siege. The health center also said prices for hygiene materials such as soaps and detergents have been unaffordable for almost all households. Abraha Gabritanse has more.
Mothers and health workers at Semen Health Center in Mekelle say children are suffering from preventable illnesses due to lack of hygiene as prices for soaps and detergents skyrocketed. We met Tsarha Halofom at Semen Health Center in Mekelle seeking medication for her 3 children who have been suffering from scabies, a contagious skin disease, and fungal illnesses. She says her children have been suffering for more than 2 months as they couldn't get medicine.
I'm called Tsarha Halofom. It has been 2 months since my children developed the skin disease. Recently, they're caught by another skin disease where their skin is covered with spots of swells filled with pus. Now the nurse has prescribed medicines for them to be brought from private pharmacies, but I can't afford it.
Tsarha's sister-in-law also shared as Tsarha and her children's condition, for Tsarha couldn't speak more as she got emotional in the middle of our interview with her.
The whole family of Tsarha is suffering from scabies. She couldn't bring them to a health center early as she didn't have the money at hand. She took them to a holy water, but their condition didn't improve. It has been the same when we visited them every so often. So we borrowed some amount of money and encouraged her to come to this health center. But there is no medicine here. As you can see, the nurse is telling us to buy the medicine from private pharmacies. The money wouldn't be enough to buy the prescribed medicine as the prices are unaffordable.
Helen Abraha is a nurse at Semen Hill Center working in the child care unit, particularly for children under 5 years. She says children are awfully getting sick and most of their illness are caused by lack of hygiene.
Children are frequently getting sick. Most of their illnesses are common cold and hygiene-related diseases such as diarrhea, skin diseases, and eye illness. Due to the siege, soaps and other detergents are hardly accessible as their prices have skyrocketed. These diseases were easily preventable before, but now we're unable to manage them. The case is worse on children from economically deprived families.
Helen adds all medicine in the health center has been completely depleted and families are unable to afford to buy it from private pharmacies as the prices for medicines are unaffordable.
There is no medicine that they can find it here. At least we should have oral rehydration salt, ORS, amoxicillin, and lubricants at health center level, but we have none. Our patients used to get them for a discount price here, but they have been depleted. When they are told to buy the medicine from private pharmacies, they can't afford it as it is very expensive. For example, the syrup that I prescribed to this child was sold for 50 birr here before, but now the private pharmacies are selling it for 450 birr. It's heartbreaking to examine a child's illness and not be able to provide them with a medicine.
The prevention-based health policy in Tigray has been collapsed over the past 2 years, as more than 80% health facilities have been either looted or vandalized by the joint Ethiopian and Eritrean forces, and entry of essential medical supplies has been prohibited following the siege that has lasted for a year and 3 months now.
And that's all we have for this edition. Thanks for watching. Bye for now.